Good evening, hello everyone, and welcome to SoftFil Academy's webinar. I'm Hannah Tebeka Azriel, and I'm very happy to welcome Dr. Abou Khalil with us for this webinar. Welcome to the webinar, Dr. Abou Khalil.
Hello.
So I wanted to just give you a few points for tonight's webinar. It will last not more than an hour. I think the presentation will be approximately 30 minutes. You can ask all of your questions in the Q&A or in the chat, but we will answer all of the questions at the end of the presentation. The webinar is also being recorded as we usually do, and it will be available from tomorrow on SoftFil Academy's website and on SoftFil's YouTube page. We are also using subtitles, so from tomorrow you will be able to watch it with French or Spanish subtitles. And yes, that's it for the little details I wanted to tell you. I will now introduce a bit more Dr. Hussein Abou Khalil, that has been one of our first SoftFil Academy experts, so using SoftFil for a really long time now. He is a plastic surgeon from Lebanon. He is the head of the Department of Plastic Surgery at the hospital in Tyre in Lebanon. He is a plastic and reconstructive surgeon, a member of the Lebanese Society of Plastic, Reconstructive and Aesthetic Surgery, and the Lebanese Order of Physicians. He also holds the prestigious title of Certified Trainer for Aptos. So he is really an expert in the field, and he is recognized as a KOL and a brand ambassador, showcasing his expertise and leadership in the plastic surgery industry. Dr. Abou Khalil is also a trainer and speaker for leading brands such as Genefil, Algenes, and Filmed, further establishing his reputation as a prominent figure in the global plastic and reconstructive surgery community. So we are honored to have him host this webinar tonight. And moving on to the next slides, we are tonight going to speak about his cannula use and technique for hip dips and buttocks shaping. So thank you again, Dr. Abou Khalil, and we will now move on to your presentation.
Thank you, Hannah, for the presentation. Again, I'm Dr. Hussein Abou Khalil. I'm a plastic surgeon from Lebanon, and tonight I'm proudly representing SoftFil. SoftFil actually is a French company who's a leader, actually an inventor in this field. It's one of the leaders in the market for cannulas production, but actually this company has a mission to make it safe, simple, and comfortable for the patient. And being innovative, actually, they combine this innovation with all the technology that they can achieve just to give us a good solution. It's not only about cannulas. Actually, we have two lines of cannulas, but we have also this topical hyaluronidase called the topilase with a very interesting combination of enzymes and essential oils. I like this product. It's not our topic for today, but it's good to mention that SoftFil is producing also this post-procedure mask and the skin roller. Actually, today we are going to focus on cannulas for injection. We have this word precision, and actually it's all about precision. And the first item that we are going to talk about, the first condition, is how many items you have in this range, actually in two ranges, the body range and the face range. And someone will ask, how many sizes do we need actually when we use cannulas? Do we need this much of sizes with different diameters and different length? Actually, if you didn't used yet, and I believe that everyone in this meeting is already a user of cannulas. If you didn't try yet the 23 gauge cannula with 5 centimeter length for, let's say, face contouring, and the 23 30 millimeters for nose filler, you will never understand the importance of this much of this diversity of sizes for our daily use, for our daily practice. About the range, we can say that this diversity allows us to apply more precise placement of the product. And actually, it's not only the diversity. This product is unique. Why? One, we have a special configuration, a special design of the tip, and this will allow you to slide, actually to go softly in the tissue. And it's not only about gliding, it's about safety. So it's not sharp to cut the tissue, and it's not too blunt to stop in the tissue. You can glide safely with this, let's say, with this optimal round tip to achieve whatever you want safely. Second, we have this graduation, those lines. If each 1 centimeter is graduated on this cannula, and this, you know, you are users already, and you know that sometimes when we are too deep, we need to know actually where is the tip of the cannula, especially when we inject body, because we go a little bit deeper and we can lose that vision, that control of the tip of the cannula. And this is why when we got this kind of graduation, we can be precise. Again, precision. A perfect combination of rigidity and flexibility. When I say this, I mean that sometimes we need to choose the hard cannula because we need to go through some tissue, some fibrotic tissue, and we need that cannula to be resistant and to go through the tissue. And sometimes we need a flexible one because we need to make some curves, and we need it to be more flexible, actually, to draw our lines, to make this contouring in a comfortable way for us and for the patient. What about the contact between the stainless steel and the tissue? It will be sticky? No, of course not, because it's coated, it's silicone coated, and this is a new, actually, again, one more excellent benefit of this innovation called the SoftFil cannula. Actually, we need something else. We need safety, and we need to be sure about the lower lock. Because whenever we use stiff products, which are with a very high G prime, products where you need to push, and you need to push harder to move the product through the cannula, you need to be sure about this lower lock. It's a detail, but we all know that excellence stays in details. Excellence is in the detail. And this beautiful idea with the dot, which will show you the direction of the output, the outlet of the product. All of these are characteristics, are the PowerPoint. Actually, the power of this product is when we talk about professionalism, we need to know that we have a different product than all what we can compare in the market. The easy guide is not our topic for today, but it's very good to know that we have a range from 22 to 27, 22, 23, 25, 27, which comes with this easy guide. And what's the idea about this easy guide? The cannula will find the hole easily, and the cannula will never touch the skin. It will glide on that canal inside the easy guide, and we will find the cannula easy going inside the tissue without touching the skin. And we will talk about this maybe in another meeting, maybe in another webinar, who knows. Today, the topic is the body range. The body range, again, we have a good range, a good selection of 7 different items of cannulas. And someone will say, okay, I'm using 18 gauge and I'm happy with it. Okay, what about 14 gauge cannula for buttocks, and why not for breast when we use it for fat? What about the 16 actually for buttocks and breast in 2 sizes, 90 and 70? What about the 18, the classic 18 in 2 different lengths? And why not a 20 for neck, for décolleté, and why not for abdomen and legs? This is why